Welcome to the ListenUp Podcast, where we explore hearing loss, communication, connections, and health.
Hi, Dr. Mark Syms here. I'm the host of ListenUp Podcast, where I feature top leaders in healthcare. I have Jeremy Weiss here of Rise 25, who has done hundreds of thousands, no, just thousands of interviews with top healthcare experts. And today we're flipping the script because he's going to interview me about unusual cases. So
thanks, Dr. Syms. Sometimes it feels like hundreds of thousands, but I'm excited about this episode in particular because we're going to talk about crazy cases. And this is like when you're sitting around with your family and you're like, guess what happened today? That's what this episode is going to be about. This episode is brought to you by the Arizona Hearing Center. And I know you help patients to effectively treat their hearing loss so they can connect better with their family. It's not even about gaining your hearing as much as it is connecting with your family and your friends and remaining independent. That's the most important piece. And the reason you're so passionate, there's another episode where we go in depth about this, but you're so passionate about helping patients because you lost your brother Robbie twice. And you can hear that story in the podcast. And, if people ask you what you do, you are the ears in ENT. You've performed over 10,000 ear surgeries over the past 20 years. So check out the Arizona Hearing Center, what they're doing. He's also the author of Listen Up. Go to listenuphearing.com. So to check out more, you can go to azhear.com to learn more. Let's start with the first crazy story. You were telling me a little bit before we hit record, and I couldn't even believe that. Yeah. Possible.
So, I take emergency room and emergency call. And so I frankly, I didn't believe the call either. So I got a call from an outlying hospital that a patient had a car key with a key fob lodged in his ear. And, I kind of thought they were kidding, right?
It's not easy to do.
No, it's not. And so, but actually, if you think about it, if you put the key fob here and you punch somebody, actually this part of your ear behind here is what we call pneumatized. And so it's a honeycomb type structure. So the reality is he had been stabbed in his ear with a key fob. So, unfortunate, right? Unfortunately, I will tell you, obviously the police were involved in all that, but just from a medical point of view, it's kind of interesting when you go down to see your patient for the first time and he's got the little box part with the button sticking out of his head behind his ear. So that was definitely interesting.
So what did he do to get that?
Well, most of these stories, what does it always involve? A girl, a woman, right? So he was, I guess, inappropriately, and unfortunately, another common denominator is alcohol. So he was in a bar, hassling some other guy's girlfriend. The thing I don't know is how the guy who put the key in his head got home, because his key was in this guy's head, for one thing.
I mean, think about the ultimate revenge, right? The person hits on your girlfriend. He ends up taking the girlfriend and your car and leaving. Now he's got the key to this guy's car.
Right. Yeah. Well, it didn't work out that way for him because he ended up in the emergency room with somebody else's key.
Yeah. Not a good outcome. But that is a good question, how that guy got home, because he had no key to his car.
Well, I actually think the police took him to a different place rather than home.
That's a good point.
So I don't think he got home that night.
He got a ride home from a police officer.
In the back vehicle of a car.
So that's definitely unusual. So what do you do in that case? Do you have to numb it up and take it out surgically? Or
the issue with that was the biggest concern is there are some great vessels. The vessel that drains most of the blood from your brain down into your neck, back to your heart, is right around there, the top of the jugular vein. So the big concern was worrying about bleeding. So, we set up, we were ready to control any bleeding. We had all the instruments open. The guy went to sleep. I turned him around. I had it all prepped, so if I needed to open it up and everything, I pulled the key out. There was no bleeding. I handed the key to the nurse. We cleaned him up and woke him up. So it was one of those proverbial.
It could have been bad. Probably we're talking millimeters sometimes with these situations.
Correct. It was. It was actually. So the reason it was so hard is because the tip of the key was abutted to that vein. So it was very difficult to tell had it gone up next to it or had it actually punctured it. So, I make light of it now, but that was actually the best possible outcome.
It's scary.
Yeah. Well,
do you have to do imaging? Like, do you do an X-ray of the area to see?
CAT scan.
A CAT scan.
Yeah. So,
jeez.
So you still got to take it out.
Yeah, exactly.
Walking around with a key in your head. And you know what? If you do that, you're not going to be successful in the bar the next time if you have a key in the back of your head.
No. What, any other crazy ER stories like that?
That's probably, people put crazy, kids put crazy stuff in their ears. I had one guy who had, I've never taken this many out. This was actually recently. He had 10 Q-tip tips in 1 year. And so,
over how long of a period do you think that happened? I don't
know. So the one thing
it's like
they were all matted down, right? And so,
wow.
One of the things I always tell people is, I always say Q-tips are the tools of the devil, right? Now, so, if you look on the back of a Q-tip box, one of the directions says, do not stick in your ear. So obviously he didn't follow that.
What do people do with Q-tips if they don't stick it in their ear though?
Yeah, that's a question. Well, first off, I would say that's a question for the manufacturer, not for me.
Right.
But if you go
it's like you get an orange juice, do not drink. Like,
right,
what am I supposed to do with orange juice then?
But interestingly, if you go to qtip.com, they've got all this other stuff, makeup application, removal of stuff, cleaning stuff, like silver, all of this stuff, like everything but the obvious, right? It's like the paraphernalia shops in the old days, where well, what are you using this bong for? Tobacco.
Yes. We're talking denial, like people are in denial of their hearing loss, but at what point for the Q-tips, like at Q-tip 4 that fell into his ear, 5, 6, 7, like what did they say?
I will tell you, I do know where it happens. I ask this people all the time. I go, can I ask you a question? They go, what? I go, did you get the Q-tips at the dollar store? And they inevitably say yes. And so what it means is that the little cotton, so the dollar store ones are plastic. They're like mini straws rather than the cardboard of the Johnson & Johnson Q-tips. And they're just not adhesed well to that. They come off. But you're right. Like you wonder, like, did he look at the Q-tip when he took it off and said, well, that's a purple end, but there's no cotton on the end? I don't know. But I mean, it was like having the, in the circus where they've got the VW bug and the clowns just keep on coming out. That's what his ear canal was like. I was like, oh my God. I mean, I've taken 2 out. I've never taken, it was like 8 or 9 in 1 ear. And at the end, he's like, wow, that feels really much better. I was like, I would think so. So,
wow. So what else do people lodge in their ears?
Kids, oftentimes they'll put erasers, beads. There's oftentimes, in the summer, I always see sand because people go body surfing in Southern California. They get sand in their ears. What else have I seen? The kids love putting little parts of little toys, there are all these little plastic pieces, I've had kids put glue in their ear. They put the Elmer's glue in their ear. In other people, sometimes their part of their hearing aid comes off, and then they put a new one on and pack it in. And so I've seen people where they've got 3 of the parts of the hearing aid kind of lined up like a train in their ear canal. So there's crazy stuff in there.
What about? Do you have any really extreme wax removal stories?
I do.
Actually, I am weird. I'm one of those weird people. I will watch wax removal videos on YouTube.
I tell people the technical name for a wax is cerumen. So I tell them I'm a cerumenologist, right? Like I just, it's my specialty. I haven't figured it out yet.
It sounds more official.
Do this for a future podcast. I want to weigh how much wax I take out in a week and then extrapolate that out to 52 weeks and then to my whole career and try to figure out like how many pounds of wax I've removed in my.
Can you just in a week put it in a big ball and show it to people? It's probably not allowed.
Well, you could. It would just, frankly, it would be extremely gross.
Exactly. That's why you do it.
Yeah, I know. There are these videos. People go, I watch those videos. It's like I live those videos, if that makes sense. So
we should start get approval of some people to start getting approval of you filming the wax removal. I would watch those.
You would?
Yeah, I would 100%. I watched them.
Interesting.
Yeah.
It's kind of like people love watching, like, remember
it's the pimple popper.
Yeah, but
cool.
like, the one type of show I don't like watching are medical shows, right? Because it's like I watch it all, I do it all day. So, but I understand what you're saying. There is a fascination with it.
So extreme wax removal. Tell me about some.
Well, I've had people where it's literally, again, it's like they basically have packed their whole ear canal from top to bottom with wax. And then there are other people who have had surgical alterations of their ear where they accumulate even more wax. And so, you can get a piece of wax out like, the size of, half of my pinky out of people's ears and stuff.
Well, is it just a genetic thing? They produce more wax, or
no,
is
I
it
think,
not a hygiene thing? What is it?
It's this big, it has to do with if you alter their ear canal surgically, the wax doesn't travel out the ear canal as normal, and it kind of gets in a jetty and accumulates on itself. So it becomes a little bit like a snowball where it goes onto itself. So there's another process that I take care of called cholesteatoma, which is where skin builds up on itself, and it's kind of like a snowball, and it dissolves bone. I mean, I've seen them where they, are so big, they go into people's brain. And, I did an operation today where it had unfortunately destroyed a guy's hearing and gone into his balance organ. And,
wow.
What
was it? Wait, what is it?
It's a cholesteatoma, it's called. It's basically a cyst of skin. So if you have your eustachian tube between your ear and your nose doesn't work, a vacuum forms and part of your eardrum gets sucked in and averted, and the outer part of your eardrum is skin. So skin everywhere in your body sheds. So what happens is you get this ball of dead skin, and it gets bigger and bigger and bigger. Like when you build a snowman, a small snowball, and it gets bigger and bigger and bigger. And so as it gets bigger, it dissolves bone. So it'll go into people's hearing organ, it'll go into people's balance canals. I mean, we have what we call, microsurgical technique, where I operate under a microscope to deal with that. Interestingly, 100 years ago, this killed people. It was the number one killer of people between the ages of 20 and 25 100 years ago. And now it's like almost, in the United States, never heard of. In the third world, it does happen occasionally, but just this is like a disease where modern medical technique has totally eradicated. But I still see it. I did I did one today and two on Tuesday. So I saw 3 patients where I did cholesteatoma surgeries in a week. So it still exists.
How do you get it out? Because I figure it's big, it's building from the inside. Well, you can't just pull it out.
No, you don't. You have to go through the mastoid, which is the bone behind the ear, and go through the ear canal and work through the ear and remove it. And then it oftentimes involves the bones of hearing. So you have to replace the bones of hearing with an artificial bone, and then you have to rebuild the eardrum. So it's a multiple, there are multiple steps in the procedure, but it's one of the more common operations I do.
Is it a sign of this hearing loss? Is that like?
Yes. Hearing loss. The other thing is recurrent infections. So people will have an infection, then the ear will go quiet, and then they'll get another infection, and that'll happen like a couple times a year, every year on a continual basis.
They will think it's an ear infection or something,
right. So what happens is that dead ball, that skin, that cyst of dead skin gets infected. And so when it gets infected, you get pus, it drains out all the dead skin. When that goes away, it starts building up the dead skin again. And so it's quiet while it's building up the dead skin. 6, 8, you get some water in the ear, bacteria. So you have these breaks, but repeat infections.
Wow. And so what other, side effects do they have? So it could affect their balance, like hearing loss, and what else? Hearing loss,
balance, chronic discharge. Those are usually things. It's usually in people who had infections as a child. And it kind of, some of them it'll catch up in their childhood or early teens, some of them in their 30s and 40s. And they're actually people who present for the first time in their 60s and 70s.
So. Talk about, tumors. What's an example of someone who presents, because I imagine a lot of these may just look like normal hearing loss, but then when you go and you discover something,
Sure. So one of the most common things that I see and work up is what is called asymmetric hearing loss. And that's where one ear doesn't hear the same as the other. And people sometimes don't think about that, but that's not normal. People should, I always tell people your ears should hear equally good or equally bad. So if your hearing loss is from aging, let's say, if you look at my head of hair, it's not like the right side's going to get gray and the left side's going to stay dark. I mean, the only person that happens for is Cruella de Vil, right? And she's a kind of a cartoon character. But anyway, so you would expect both sides to age equally. So if one side hears differently than the other, that can, on occasion, be the presentation of a benign tumor that grows on the nerve between the ear and the brain, and that's called an acoustic neuroma. So when you look at people who have this asymmetric hearing loss, they all should get a medical workup. In other words, they need to go see a physician to go and make sure that they don't have this process. And so that's, one of the great things about what we do at Arizona Hearing Center is like you get that soup to nuts. Like we have a medical team and we have a hearing technology team. So, the hearing technology team does hearing technology. That would be cochlear implants, hearing aids and stuff like that. But if you have medical stuff where you have an infection, wax, like I said, I'm a cerumenologist, or, you need a medical workup to make sure that you don't have a tumor, or you need a surgery to improve your hearing. I mean, I saw a guy yesterday, he just signed up for hearing. He's had a progressive hearing loss for 25 years. It's the point where his hearing aids don't work anymore. He comes to me, I'm the first physician he sees, and he's like blown away by the fact that he can have surgery and his hearing can be restored almost to normal. So, and those are actually funny stories. So when you talk about funny things, when people have such bad hearing loss, they haven't heard anything. I love asking them, well, what did you hear for the first time, or what did you realize? So, and one of the common one for men is, when they urinate, they hear that they haven't heard the pitter patter of the water in the toilet.
That's what the first thing they hear.
I forgot that did that. Or they'll report that they went all over their house because they heard a noise or a buzzing, and it was just like the condenser on their refrigerator. And
they just never could hear it before.
They haven't heard that stuff. Or they'll just go, wow, I forgot that birds made noise. I mean, it's pretty amazing. There's all this stuff that you and I hear all the time that we take for granted that people just are like, I haven't heard it for forever. And that's actually a really fun part of my job, when people hear things that they hadn't heard from a long time. I mean, that's one of the most satisfying things to do.
What about the category of infections? What do you see?
So, we talked about cholesteatoma is the result of a long-term infection, but, I also see what are called acute or sudden infections. People will rupture their eardrum and get discharge from their ear. Probably the most common infection I see is outer ear infections, which are similar to swimmer's ear, where the outer ear canal gets infected. And so that actually brings me back to the old culprit, because the number one culprit or cause of that is use of Q-tips. So the Q-tips cause the outer ear infection. So if you look at the incidence of outer ear infections in my practice, greater than 75% of them are on the right side. The reason is most people are right-handed, which also means people go to town with the Q-tip on the right ear, and then when they go over to the left ear, they're much more careful so they don't traumatize the ear canal as much. So it's amazing, because what they'll say is, my ears itch. And I always say, your ears itch because you use Q-tips. Your ears are infected because you use Q-tips. And they'll say, well, I use the Q-tips because my ears are infected and they itch. It's like, it is a chicken or egg thing.
How can you stop people from using Q-tips? I mean, I've seen people in my family, I won't name names, and I'm like, you shouldn't be using that. And I cannot convince them to stop doing
I have a sibling who has a container of Q-tips this big in their bathroom at their house.
Exactly.
Or, she'd hate me to say this, but I always say, my wife, I'm married to somebody and I can't get her to stop using Q-tips. So, it is what it is.
It's a tough one.
Right?
Yeah,
it's a tough one. I have another relative who used to say, but when I take the Q-tip out, it's always yellow. I was like, right. They make them stark white. So when you bring them out, they're soiled. So you think your ear's dirty. The question becomes, is wax bad? And wax is not bad. It's healthy and good, right? So it has multiple functions. One, it's a mechanical barrier, meaning it's like a tar covering your ear canal. Two, it has a pH or an acidity that kills off bacteria. So when you take it off, you, one, take the tar off, and two, remove the acidity. And then the third, which is not as applicable anymore, it's sticky. So it prevents bugs from going in your ear and things like that. Actually, not for my practice, but if you look across the world, the number one foreign body in somebody's ear is a bug.
Really interesting.
Well, that is another crazy one, because I've had them where, it really drives people crazy when the bug goes in and it's hitting the eardrum.
Oh gosh. Are there any interesting stories with bugs in ears?
Well, so here's the key. You want to fill the ear canal with oil, not water.
Will that damage something?
No, what the oil will do is it'll suffocate the bug and kill it.
I mean, I think I would just come into you, have you remove it, as opposed to coil.
Well, the point is you want to kill it so it's not beating on your eardrum.
Oh, I gotcha.
Right. So you put oil in your ear. The thing is if you put water in your ear, it kills it, and then the body starts swelling.
Ugh.
And it becomes harder to pull out.
What kind of oil?
Just whatever. Maybe, olive oil, Crisco, baby oil,
avocado oil,
grapeseed oil, something, peanut oil, something.
I want to get a bottle of Dr. Syms oil, special oil, a blend of all of them.
Yeah, that's correct.
To kill the bugs.
Secret. I'll be like the Colonel Sanders of bug killing in the ear for now with my secret formula.
Have you seen people who have like deadly bugs, like scorpions or something? No,
they don't tend to go down there.
Okay, so just like
run in the mill
bugs,
cockroaches, those types of beetles.
Wow, this is great. This is
Would you like to see videos of that too?
I do. I would after this, I'm going to convince you to start taking videos of this wax removal and bug removal for sure. 100%.
There you go.
So everyone should check out azhear.com, check out listenuphearing.com for the book and more episodes of the podcast. Dr. Syms, it's always a pleasure.
Thanks, Jeremy. Appreciate it.
Thanks for tuning in to the ListenUp Podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.